Good afternoon, everyone at Cedar Crest. This is Dr. Lopiano again, your podiatrist on staff at Cedar Crest Village. I'm here today to have a discussion with Miss Brooke Artesi, Mrs. Brooke Artesi, the founder and owner of Sunshine Orthopedics and Prosthetics. And Brooke is the person that I go to for all of my orthotic and brace needs that we do find that we do need here. Brooke, tell me a little bit about yourself.
Okay, I basically have been in the prosthetic orthotic field for about 15 years now. And I recently, about 3 years ago, opened my own practice in Wayne, New Jersey called Sunshine Prosthetics and Orthotics. I have CPED credentialing, I have certified orthotist, certified prosthetist, and I have certified mastectomy fitter. So I have a whole range of credentialing to deal with every part of the body and whatever we might need to do.
Yeah, I believe you're one of the few people in North Jersey who you are certified for the post for mastectomy for prosthetics for post mastectomy patients and candidates, survivors.
Yeah, we do custom breast prosthetics. So it really is one of the only facilities in the area that is certified for the custom mastectomy products.
Wow, that's great to know. Wow. So basically, we're going to get back now to what we have in front of us here, as you can see, are an elaboration here, a little sampling of some shoes and some braces and some orthotics, which are basically custom-made inner soles to basically take care of foot imbalances. Brooke and I, basically, we study the same anatomy that you have to go through to learn how to fabricate and what the pathologies are, the problems are. Everything from drop foot to heel spurs to people who have post-stroke CVA, and you have the weaknesses on that side, the hemiparesis. And so, you know, Brooke knows the same anatomy. In fact, she deals with a lot more going up the body and upper body too. But so we're here to basically show the things that and what they do, what they're here for. I find that we see a lot of people that have weaknesses in their foot and ankle and leg, and wherever it is, and we work with physical therapy, but we do a lot of brace work. And so tell me about what some of these braces do here, especially like this one here. This one basically is called a noodle for the reason that it's a very thin bar. So Brooke, I'll let you take over.
So the number one diagnosis that I see in the office is foot drop. So foot drop can come from many different things, stroke, back surgery, or some reasons we don't know. But in that case, you constantly have to think about pick up my foot, and it causes imbalance and just difficulty walking. Something like this just takes that fear away of walking. So you don't have to think about picking up your foot anymore. You walk with ease, you have a lot more balance, and there's a lot of energy return in something like this. So it allows you to get around uneven terrain, you know, the steps, the ramps, stuff like that. It really eases up your gait. So this is a noodle. It's a very lightweight brace, very easy to fit in a shoe. Goes right under the insole. Usually patients have no problems with this. There's no skin contact. It's very simple. There are other versions of foot drop braces, but this is our go-to if we can do this. So that's kind of the noodle.
Yeah, they also have a dorsal brace, the one that looks like a shin guard for baseball. But and can you tell me the difference on that one?
That one has a shell in the front, so this is behind your calf.
Right.
The other one would have a shell in front of your calf, and we use that one sometimes if someone has a knee instability as well. So, you know, they have a little bit of knee buckling problems or just a little quad weakness, so weakness in the upper leg. But either way, you know, you come to the office, we put a couple of different samples on you, kind of evaluate, and then you can be involved in the final decision of what you would actually want. So.
Yeah.
So that's kind of the
I have some patients that will try, and then basically I'll let you do the evaluation and the recommendation, and then so I'll see people coming back to me with either this noodle or the dorsal brace.
Yeah. So they all work. They all work great. Very lightweight, very easy to use, very easy to put on by yourself too.
And you could also put your inserts, your orthotics on top of that too, right over it, so you're not going to be barefoot over that shell. So some people, you know, basically you really can't have your foot against that titanium.
Yeah,
graphite,
especially
graphite,
diabetic.
yeah, right, especially
So,
diabetic.
want to keep you protected. Fits great in any shoe. We have some double depth shoes we can do with it. Or if you bring in some footwear, we can try what you currently have.
Can you explain what this brace is,
So
Brooke?
this is a Ritchie brace. And this one is basically used for someone that has a very, very flat arch. So they're kind of turning in a little bit as they walk, painful ankle. This just puts you into a nice even position and helps with balance. So that's the, the simplest way to describe that is the Ritchie brace. Can also be used for dorsey, for foot drop. And we added a special hinge that helps pop the foot. So someone that might need a little bit more left to right control as opposed to just a foot drop would get something similar to this, or equivalent. There's other ones too, but this is it's very easy to fit in shoes, usually very easy to modify. A lot of things I do at my office are custom. So you try it, you go home, you have a problem, you come back, we adjust it. So it's not like it's stuck, oh, I can't wear it. No, you come back, we'll evaluate, and we can do some modifications in-house, because I do have a workshop in the back at the office. So
yeah, I've been there. It's a great facility. It's right at the Kohl's turnaround on Route 23. She's in a beautiful steel and glass building there, and she's in the back on the first floor. When you walk in, you'll see the directory, and we walk by there. She's got a beautiful laboratory office. It's with beautiful murals. The waiting room is really fabulous, very nice.
Thank you.
And so she does all her work, and she's very accommodating too. She really, Brooke, you really do a great job. When someone has to come back, I'll tell them, go back and see Brooke. She'll work with that problem. She'll grind it down, or she'll make sure that it fits well. Because we have a lot of also diabetic patients too, and it's sometimes that we will have to give them special orthotics inserts to offload, to take away the pressures. That's a big thing basically that I see, is that I have to do pressure accommodation. What that means is that I have to sort of make something very soft to put inside the shoe to take away that pressure problem, because the foot, basically does lack flexibility as we get older. Here's a little board I have here that showing that the relationship over here between the big toe, the small toes, the ankle further up here. I'm sorry we don't have an anatomical model to show, but this basically simplifies it too, which is great. We don't want to get bogged down in too many terms. But basically, the foot has 28 bones, and then how they relate to then the next joint, which is the ankle, and then further up into the knee and hip. And all of it is related. And so there's a lot of literature out there and basically it's the old adage, the chicken and the egg. What comes first? What causes this problem first? Is it coming from this joint, or is it coming from that joint? And so there's a lot of back and forth studies being done, and but we do know clinically what does work and what doesn't work with relieving pain, alleviating painful conditions, arthritis, heel spurs. Brooke will make me an orthotic that will basically take care of a plantar fasciitis and heel spur problem. And what that is basically, real quickly, is that it's a pulling of the ligament on the bottom. I'll just basically go back to this diagram here and show you. On the bottom here, right back over here, there's the heel bone here. There's a little spur, that little black little speck coming off there is a pulling from the plantar fascial ligament. And the pain is not so much from the spur, but it's the ligament. It comes down to really, again, soft tissue problems in the foot, that these ligament strains will cause an inflammation. Enthesiopathy is the word, but basically it's just that our ligaments and tendons also age. It's just a fact that they're not as lubricated, they're not as supple as they used to be, and with all the walking around you have to do here too, you really strain these ligaments, and it's basically my job and Brooke's job to take away those stresses and strains, basically.
Yeah.
The Arizona brace, can you describe what this is here, Brooke?
Okay, so this is an Arizona brace. This is basically a custom molded gauntlet. And this also helps with patients that have a lot of pain in the ankle, and also their foot will turn in a lot, causing them to have, like I said, with the foot ankle, even if some knee pain, we put you into a neutral position, helping alleviate, we start with the foot, hopefully eliminating some knee pain, hip pain, back pain. So patients that have that turn in a lot or have had surgery and they need to have a stabilized joint or a fused joint, this will really help them have a nice natural gait and help stabilize everything, keep it neutral, and prevent overuse, stress on the bones. So it's a very, very nice brace. I use tons of these. They're heat moldable, so if the patient wears it, they go, oh, I have a little bit of pain here. You come back, we'll fix it. It comes in laces, different colors, and Velcro, so you have your options. We really customize the option that's good for you. And it fits great in a shoe. So everyone's like, oh, it's so big, it's so big, it's so big. No, it's not. And this is a bigger shoe, but we really can get it into a lot of shoes. And like same thing as the other braces, I have patients come to me with their shoes, and we try to make it work. So it's
sneakers, yeah.
Yeah, definitely a sneaker works great. Obviously not a little flat, but it does the trick. And I have a lot of patients that really tell me it's helped them tremendously in these braces. So just a very nice option to have.
Right. Yeah, here we have some samples of shoes over here, and basically what I do a lot of basically here as part of the diabetic shoe plan that Medicare, and also getting back, good point now with insurance, Medicare does, and I think most of these cases, all these cases, cover for all of these problems, such as foot drop that we mentioned before, and for the tendon problems, tendon strains. So it's not just being diabetic that you have coverage for, but also these problems too. So again, these type of shoes, they have a fabric on the front and sides, a lycra fabric and neoprene. It's very soft and supple. It allows give and motion. One of the problems too is that we have patients that you'll have certain times where your leg will swell up more, edema, lymphedema, which is a condition related to the fluid dynamics, the water retention that you have. And if you suffer from that, you know, and you've been told by a primary care doctor and specialist of what's causing it, whether it's from a weakness in your heart or your kidneys, or you have just a poor functioning lymph system that basically is the channels that whisk the water up your leg and your veins too. If you have chronic varicosity veins, varicose veins, you can't get the blood up the legs, and that basically causes you to swell up too. So what happens is certain days you may be more swollen than others, and that's when we basically will recommend shoes like this if you're having that problem, so that it allows the foot to stretch.
And
in
forefoot,
these shoes.
hammer toes.
Exactly right. The forefoot, we see a lot of problems with bunions, hammer toes.
This is a great shoe for that.
It's a great shoe. The Dr. Comfort line is really a great line. It is my go-to brand, really. So they're, you know, as we know, SAS, PW Minor, there are other ones too, but Dr. Comfort has really excelled beyond SAS in providing the fabric material and stitching that they have, the shapes and styles that they have for shoes. They're really great.
This shoe is awesome.
Tell me about that one.
Yeah, this one is a really, really great shoe because for someone that has trouble getting their shoes on, open all the way.
Right.
So same thing with the edema or forefoot deformities, or if we have a brace to put in here, really just, it's so easy to put on. You know, a lot of patients that can't bend over love this shoe.
Yeah,
love it.
I think the Edward model, right? That's very good. I use that too.
Yeah, it comes in male and female versions, this shoe.
Right.
So I just, you know, when all else fails, try this one.
Right, right, that's good. Yeah, there are also two other brands of shoes that, you know, that Medicare does cover, and I have many catalogs in my office, and you know, they're also different. Sneakers are our coverage. Sneakers are also extra depth. Sneakers are a covered item. New Balance makes their line. A lot of the shoe manufacturers now are making extra depth lines so that people can take advantage of this, and Medicare does reimburse as long as it's that coated shoe. So the orthopedic shoes and sneakers now look like your regular shoes and sneakers that your grandkids would wear. So they have great styles too and colors, and so it's not just what you see here. Like here's a shoe with a lift in the front there, and the other fabric shoes that we just showed. But so there's a lot of variety. The Mary Jane style with an open top and strapping that goes across, or slip-ons. As long as it has a closed heel, it'll qualify for Medicare coverage for diabetic shoes. And basically, it's one pair a year, and you can jump sooner if you jump into the new year from, let's say, the middle part of the year. You can jump earlier before the 12-month calendar year. So some people will come to me and ask, and if they qualify for that jump, they can get the shoes sooner than 12 months. So, and again, these shoes last you know, a long time too,
Yeah,
and so you can get different varieties.
and the 3 pairs of inserts.
And 3 pairs of the heat molded inserts too.
Yeah,
that you
or
get
custom
with that.
if they need it.
Yeah, this material I really love. You turned me on to this, Brooke. This is the pink plastizote,
Yeah.
which is and this is used to line a lot of the custom molded shoes use this material.
Yeah,
And
we do that too. We also do custom molded
yes,
shoes.
custom molded shoes.
I didn't bring a sample of that. But.
So tell me about a custom molded shoe. What's the difference between that and an orthopedic shoe?
A custom molded shoe is also covered by Medicare if you have something where you need to offload, we need to really, a lot more stuff going on than just being needed to be fit for shoes for accommodative purposes to protect a diabetic foot. So if someone has, or very swollen, or they have a, like a fixed ankle or a deformity of the foot ankle, we can do a custom shoe.
Rheumatoid, right.
Yeah, custom shoe, which are also very nice, very, very soft, have the soft lining and the insert, the custom insoles, and also I can adjust them because they're custom. So patients wear them, they have a problem, we come back, we play with it, and it's just another option if an off-the-shelf shoe doesn't work for you. So we also do provide that.
Yeah, the insoles are removable so that every couple of years or so with a custom molded shoe, you'll have to get a new plastizote innersole manufactured
And it comes with
again.
3. We do it with the 3. The 3 sets of inserts so that every few months you change it or you swap it out, depending on what you can remember, I guess, to do.
Right.
And yeah, and then we have to do the custom shoes don't have to be done every year, but you can get a new pair every year. But it's the same as the regular shoes.
Right. I mean, braces is a 2-year period, I believe, for the braces? Or?
Braces, same and similar, as Medicare calls it, is 2 years. So you can get a new brace every 2 years. If it's something completely different, you know, maybe if you had surgery and something's
there are
changed,
exceptions.
yeah, then we can evaluate it. And you know, our office helps out. You know, the girls in the front office, they have Shelley and Beverly, they're great with the patients. They'll call, get your information, and you know, help everyone kind of figure out what their coverage is. So, it's you know, we want to do the right thing and see what we can get done.
Yeah, come down to the office, the medical center, and we have brochures there for Brooke, for her company, for her place there, so you can get directions. I'll be happy to give you directions how to get there, and very, very accommodating. And yeah, so okay, I think we covered just about everything. I think. Thanks. It was really informative again too. For me, and I'm sure for my Cedar Crest patients. Oh, one other thing. Those old-fashioned hinged braces, those are the external metal.
Yeah.
Tell me about, are we seeing less of those, or?
I am seeing less of those, but I'm still doing them. So they're called conventional AFOs. So an AFO is an ankle foot orthosis.
Okay.
And normally, if we had to do a custom AFO, we would do a plastic one or something similar to that. But if someone has a lot of edema or can't handle anything skin contact, or just had a conventional AFO from years ago, we can fabricate that. And they're built into the shoe. It's a lengthy process, so it's not the quickest thing. I can turn around most custom braces within 2 weeks, but those are a little bit longer because we have to pick out a shoe, make sure the shoe fits, cut it open, put in a caliper, fit the joints, bend the joints, and fabricate a cuff. So we do them.
Right.
We do them, but they're just a longer process.
Yeah, we have 1 or 2 residents here who do have that type of.
Yeah, I think I'm seeing someone currently.
Right, probably
we're doing one.
someone there. Can you tell me anything about the more balanced brace? This is something that is getting to be kind of hot with podiatry for fall prevention. The more balanced brace was developed by a podiatrist, Kenneth Moore. But basically, it's like an encompass type of it's like just a Ritchie brace that we have here, but it surrounds on all sides, posterior, the back part, the inner and medial part. Have you had anybody come to you asking for a more balanced brace?
I haven't, but I know what you're talking about.
Okay.
It doesn't have a hinge on it.
No, there's no hinge. Yeah.
Yeah, it's just from something like that, it looks more like a custom plastic AFO, but more low profile, thinner, fit in a shoe better, and it would just be to control the excessive, you know, arch falling in or falling out, and just it's the height of this. So it's not as high. A regular custom AFO would go just about 2 fingers below your knee. So that one's lower, like this one would be lower. But the balance brace, it's a good option.
Yeah, that's something that is new, and at my conferences I'll be bringing it up, and maybe even just speak to those people that I know for many, many years, and mention too that, you know, it's great to make these things. This more balance brace, though, is a little controversial for me, because I find that if we give people a lot of things to wear, yeah, that's great, but what happens now when you have those type of people then that do really may need it, they're sort of kind of frail already, and if no one's there to help them put this on, that's not going to serve the purpose then. So they're not going to wear this. If they have to go to the bathroom at night, which the frequencies of toileting and at night, you know, it happens. They're not going to put this on, and these where a lot of the falls do happen, is the nighttime falls. So these type of devices, you know, really don't really help too much as far as preventing falls. More studies have to be done, but I think a lot of podiatrists, especially now, are rushing into this a little headstrong and not looking at the whole picture too. And that'll be my job when I go to these conferences, to speak about this and bring this up. And maybe I'll get on a panel discussion too and bring up the facts that there are other more factors in play with our older senior citizens, as we say, besides just throwing a device on them and expecting them to wear it, because there are a lot of things that they just can't handle. So that's why I just may want to touch on that, and so that's something to be continued. I'll be probably speaking about that in the future. Well, Brooke, I thank you. It was really a great. Thanks for coming down. I really appreciate you coming down.
Thank you.
I wanted everybody to see Brooke also. So this is the person this is my go-to person here for all my special orthotic needs, insert needs. So if you do have any questions, please come to me, because things change, and even sometimes you may not even need an orthotic. You know, balance is very important, and you know, that has to be looked at. Sometimes we'll take away someone's orthotic and just give them a soft inner sole to put in, and Brooke, you'll help me out with that. That'd be great.
We do it all.
Great.
So.
Excellent. Thank you so much.
All right, thank you.